Katolik Muhammadiyah Semarang. Okay, I will answer the question from case study 12, version treatment of the mental illness. But before that, I will give a little explanation about mental illness. Mental illness is a collection of mental illness that affect a person's thoughts, feelings, and behavior. Mental health includes emotional, psychological, and social well-being. Factors that can influence are biological factor. 1. Disorders of nerve cell function in brain. 2. Congenital abnormalities or injury to the brain. 3. Having parents or families with mental disorders. 4. Long-term drug abuse. Psychological factor. 1. Traumatic event such as violence and sexual harassment. 2. Less able to get along with other people. 3. Feeling of inferiority, inadequacy, anger, or loneliness. Case study 12. First treatment of the mentally ill. Mr. M.R., Mrs. F.Z., and Mrs. F.G. had been involuntarily committed to a psychiatric center. It was being retained pursuant to orders of the local country court, which had found them to be persons in need of involuntary care and treatment. In that they have a mental illness for which care and treatment as a patient in a hospital is essential to their welfare, and their judgment is so impaired that they are unable and understand the need for such care and treatment. These patients refuse to be medicated with antipsychotic drugs. Their objections were overloaded and they were subsequently medicated with various antipsychotics. Mr. M.R. and Mrs. L.Z. thereafter commanded a declaratory judgment action against the commissioner and official of the psychiatric center. They sought to obtain an injunction against the non-consensual administration of antipsychotic drugs and a declaration of the common law and constitutional right to refuse medication. Mrs. F.G. refused treatment with antipsychotic drugs, but was thereafter forcibly medicated. She alleged that the forcible use of antipsychotic medication violated her common law and constitutional right to determine her own course of treatment. So, the question is, should the hospital allow mentally ill patients to determine their own course of treatment? Okay, my opinion is no. The patient should be compliant with the treatment recommended by the hospital because the doctor or nurses understand what needs to be done and understand what is the right treatment for the patient so that he can recover quickly from the illness. But the patient also has the right to choose treatment if the patient is considered capable of making decisions. In this case, it is not explained whether the patient has a guardian or not. If the patient has a guardian, then the doctor must discuss the treatment to be carried out with the patient's guardian or with the patient's family considered able to make decisions. At the court decision, the trial court determined that these patients were so impaired by their mental illness, they were unable to make a competent choice in respect to their treatment. The lower court affirmed the dismissal and the patient's appeal. Okay, that's all. Thank you. See you next video. Bye.